It's Richard Clark here from Kendall Physio. I'm going to chat to you in this short video today about a common cause of lateral hip pain that we call greater trochanteric pain syndrome. It's been called a lot of things in the past. It's been called trochanteric bursitis, it's been called gluteal tendinopathy, and this tends to present with pain on the outside of the hip. It can sometimes refer down into the outside of the thigh, almost down to the knee in some cases. And we're going to have a look about the anatomy through there, and also talking about some do's and don'ts and things that can cause issues. So when we're looking at your trochanter, this is the bony bit that sits on the outside of the hip that we can see in green through here. And we're just going to zoom into this. So this is the bony bit on the outside of the hip. It's got quite a lot of muscles that come in and attach in over the side of it. Two muscles in particular. One that we have here called your gluteus minimus, and then another one that sits over the top of it we call your gluteus medius. Now there's also is a kind of small bursa that sits in around this area as well. We should be able to show that coming up in a second. So this condition, we used to think it was caused by irritation of this bursa. So the kind of most common treatment for it was having a steroid injection into the bursa, usually given by your GP or maybe by your physio, and that sometimes helped pain in a small proportion of people with this type of hip pain, but they often found that it came back and it only gave them short-term relief. Now what we now know is that the bursa is only involved in about 30% of people who have this lateral hip pain, but pretty much all of them have changes in the tendons that go into it. So what we now think is it's a problem with the breakdown of the tendon, and in some cases that can cause some inflammation or irritation of the bursa, but primarily it's a problem with the tendon. So just injecting steroid into the bursa can help short term in terms of pain relief in a small group of people, but it's not going to do anything for the tendons. So exercise is really the most widely researched and most evidence-based treatment for this type of problem. Now, the other thing when you have this lateral hip pain, you can find that certain positions can be more provocative or more irritating for you. So if we're doing anything that causes the hip to move out to the side or causes the hip to cross over the midline, if we're stood in these types of positions for any length of time, that can cause some compression and irritation of the muscles and tendons on the outside of the hip. Similarly, if we're sat either with the legs crossed or knees kind of touching together, again, because we're bringing the leg closer to the midline, that can cause again some compression through the outside of the hip. The other common place where people often report pain with this type of problem is sleeping positions. So if you're sleeping on your affected side, you're often then compressing that tendon or anywhere up to 6 or 8 hours, which can then make it pretty sore. And again, similarly, if you're crossing your legs when you're lying on your back, you're going to get a similar issue. So probably the position where you're going to get the least amount of compression is lying on your back. Some people though, if they're side sleepers, they might not be able to get on with that very easily. So the other positions we recommend is lying on your side with a pillow between the knees, so we're stopping that top knee dropping across towards the couch, or almost in this kind of semi-supine position where the patient's kind of really twisted and tilted over with the pelvis, so that knee's really up and away up from the body, which again avoids getting into that position of compression. So if you are having some pain on the side of your hip, and it is worse if you're trying to lie on that side, or even if you're lying on your good side, trying to adopt some of these sleeping postures can really help to make that less sore and less painful. I suppose the other thing is just thinking about the types of things that can often trigger this off. It is a condition that's much more prevalent in women. The kind of thinking behind this is that it's partly due to the size and shape of the pelvis, that women have this wider pelvis that makes them a bit more prone to this. But also it is more common in women if they're either getting into that premenopausal or postmenopausal period. We know kind of fluctuations in hormones can really have an effect on tendons quite a lot. So that's probably the group where we have this type of problem most commonly. We do get it in men as well, although it's less often and often more seen in runners as well. it can be triggered by a sudden increase in activity levels as well. So if we're suddenly quickly increasing the amount of exercise that we're doing, that can put a lot more stress and strain through these tendons, and it upsets the balance of collagen turnover within the tendon and can lead to this imbalance, which then can lead to the tendon becoming painful. So if you're suffering with this kind of type of lateral hip pain, best thing to do is get it assessed. There's a combination of tests that we can do that are quite accurate in picking this up, and then it's just a case of giving you a bit of advice and starting you on a progressive strengthening program. That sometimes can take up to about 12 weeks, sometimes it's longer in certain individuals depending on how long they've had symptoms for, but it's a very effective way of managing this problem and getting pain free and get back to doing the activities that you want to do. So if you have any lateral hip pain yourself, or you know anyone who's suffering with this type of problem, feel free to put in the direction of this video and get them to give us a call on 01539 725 220 and book an appointment to see one of our therapists, and I'll be able to sort them out. We also can you can also book appointments via the website as well and book online. Alright, take care, and we'll see you again soon.